it seems that liberal members of Congress and even the Republicans are not very happy about the president's abandonment of the public health care option of the health care bill. Two major congressional groups say that the government option is necessary to make sure health care is accessible, guaranteed, and high quality. House Speaker Nancy Pelosi says the public option will be part of the bill the House will consider. She says it's the best way to reduce health care costs and expand coverage. But many Americans still remain skeptical. Staying with the health care debate, we are talking this morning about non-profit insurance co-ops and where they fit in all of this. And joining us this morning is Craig Gussin. He is a health insurance broker. And let's talk for a minute about the president's latest move, or the balloon that they floated. Basically, it seems that neither side is satisfied by this latest twist in health care and the co-op deal.
Not at all. You talk to the Democrats, they want a government plan, which it sounds great. They want to cover everybody. But again, the government has never been able to do anything it's ever tried to do.
Let's talk about what a co-op is. What is a co-op?
A co-op is a member-owned and member-run organization. It's nonprofit. What it's going to do for the ones that are in effect in North Dakota, which is where Kent Conrad came from, who put it together, is it allows the members, they put it together, they allow the members to go out and negotiate prices with the hospitals and the doctors and the pharmaceutical industry to bring, and they can negotiate supposedly at a very low cost to save money.
So it's like a Costco of healthcare?
Yeah, exactly. In Costco of healthcare, it's a great idea. But what happens is when you really start looking into it, because the first time I heard of it, I thought, what a great idea. But we actually had something like this in the past in California. The problem is it's going to take between 10 and 20 years to actually get it up and running really well, because you got to hire, you got to negotiate the deals with the hospitals, the doctors. They're going to have to, on top of that, they're going to have to put together the plans. They're probably going to go out to the insurance community and hire people from the insurance companies to help run it, because they're the only ones that really understand how to properly set it up and design it.
And it has to be regulated.
And it has to be regulated. And then the question is, the government, right now, health insurance industry pays $14 billion in taxes, where the co-op have to pay taxes. If it doesn't, that could be 10, 12, 14 billion in taxes that aren't coming in that the government's seeing now. And we have these kind of issues. Nobody really has come up with details. I've looked and looked trying to find details, and everything is very generic. You know, it's going to be member-owned, member-run, and they talk about North Dakota, which is where Senator Conrad's from.
Right.
Almost 90% of the people in North Dakota are on the co-op plan, so there's no competition there at all. Where the competition would work great for the co-op would be in small, rural areas of the country.
So a nationwide plan involving this co-op idea for health care is not a good idea, in your opinion?
No, and what they've been talking about is either a state plan or a regional plan, so that they can bring all the people together. From what I've seen, they need at least 500,000 people, or close to it, to really make it effective when they can negotiate great deals. 500,000
people to subscribe to this?
Exactly.
Well, so this seems like it's just getting more complicated by the day.
It is. You've got... What Senator Conrad did is he came out and said, okay, here's another option. And by doing this, maybe we can get the Republicans to come to the table and agree to it, and we can get something passed. The problem is that the Democrats want one thing, the Republicans want something else. Nobody's going to agree in the middle. And even though it sounds great on paper, it really isn't. We did have one in California called the Health Insurance Plan of California. It came out in 1993, and it ended in 2006 because it wasn't as competitive as the private market. It never was, and they only had 158,000 people sign up at the highest.
And President Obama has been not really explained what he wants to do as far. He's kind of thrown this idea of a co-op out, saying that he's not abandoning the government-run health insurance. And Howard Dean this week said that really there is no overhaul without a government-run plan.
They say that, but what they don't understand is everything they talk about the co-op, and I look at that, and I was driving here, and I noticed you have a Kaiser around the corner. If you look at the definition of what the co-op is, it sounds a lot to me like a Kaiser organization, which works really well. So we already have everything in place that they want to do. All they have to do is make it more efficient. But no one's talking about the major issue. How are we going to control cost? You're seeing OBGYNs leave delivering babies because they can't afford $100,000 a year in malpractice insurance. So what we need to do is we need to have tort reform. We need to control costs of malpractice and other things. Control costs. Everything they're talking about is competition, but it really isn't going to control the cost that you and I see every day.
And there's a new headline in the papers today talking about primary care doctors are fleeing the profession because of the malpractice insurance and the lawsuits that they're exposed to that are driving them out. It's not a lucrative profession with all the school and all the effort it takes to get that degree. It's not paying off for them.
Not at all. I mean, the study I saw says the average primary doctor makes about $140,000 a year. And when you realize they have, what, $300,000, $400,000 in loan debts, they have malpractice insurance that could be who knows how high. They're looking, going, why would I want to do this when I can do so many other things and make a decent income?
Well, the insurance companies obviously are against any sort of government-run private insurance because they're afraid they're going to be cut out of the deal money-wise, right?
They don't mind the competition. The insurance companies have always been fine with, mandating everybody has health insurance and mandating that it's guaranteed. Everybody can get it. Their concern is that the government won't pay taxes, the $14.8 billion. The government can force the doctors and hospitals to take 50 cents on a dollar, what they normally charge, and the insurance company is going to have to pick up a major portion on the other side. So right now, with Medicare, best example, Medicare comes into the doctor and says, okay, you normally charge $100 for what you're going to do. We're going to pay you $55. So they turn around and charge the insurance companies $150 to make up for what they're losing.
Right, I see.
And that's never going to change. And then you have the insurance company. So how can the insurance company compete on a level playing field?
So the system is sick, and it has been for a long time. What do the doctors think about a government-run health care plan? How would it affect their bottom line?
Every doctor I've heard and talked to doesn't like it at all. The AMA came out and said, oh, we support it, but all the doctors are going, we don't. I think everybody wants to get on board and do something to make it better. Everybody agrees we need health care reform, but we have to do it slow, we have to do it correctly, and we have to do it the right way, because if not, the cost of health care today will look like a bargain basement price compared to what it could be in 10 years from now. And every country in the world that you read about health care that has some kind of government health care or universal health care, the number one issue they talk about is how are they going to pay for this in 5 years? The same issue we have today. So there is no difference. The grass isn't greener in any other street or any corner. We just need to figure out a way to control costs, and that's the major issue we have.
Craig Gussin, appreciate your time.
My pleasure.
Thank you for coming in this morning.